The Health Department's most senior civil servant has admitted that bed blocking was still a challenge for the hospital, but said finding a solution wasn't easy. Deputy Malcolm Ferry is the Assistant Minister for Health and Social Services. And our reporter Ammar Ibrahim asked him why they were in this situation.
Part of it is the pressure at the moment for staffing in the care sector itself. I think that's a big key driver to the problem. And, you know, no one wants to be in a situation where they're staying in hospital any longer than they need to, because most people recover better in an environment that they're familiar with. So what we've done is we've recruited a senior social worker on the discharge team to help improve communications between the care sector and government, to make sure that there's a smoother transition to people who are leaving hospital and they can be put in a safe environment, perhaps through more creative ways of thinking, perhaps through having more wearable alarms, so that people can be confident that they're safe at home, and if they need help, they can press a button and that help will come straight away. But like I say, it is an issue of recruitment. So we're also looking at improving the licensing scheme so that more staff can work within the care sector, and that in itself, those two things combined will help to alleviate this problem.
You said it was, I think 42 as of the 16th of August. How does that compare to other months when you look at that figure? Is that much higher, or are we actually seeing that number consistently?
It's fairly consistent. You know, it ranges between the late 30s to the mid 40s. So it's not as if we're exactly seeing a peak here, but 40 people is too many people to be in hospital when they really shouldn't. I'm sure that's not where they want to be, and that's not where is the best use of our resources. So once people are convalescing, they want to do that in an environment that they're comfortable in and is familiar to them, and that is usually the best way that people recover.
I mean, 40 beds sounds like a lot. Is that not going to put a lot of pressure on the hospital?
Of course, it's not where anyone wants to be, but it is a problem that we are attacking from lots of angles to get this right, because really even 5 or 6 people being in hospital for longer than they should be is not good for them, it's not good for the service. So we are actively seeking solutions to this problem, and it's not one solution, it's a multifaceted solution.
These 40 people, how long have some of them been there?
You know, it can range from a few days to a couple of weeks, but you know, it's important that we get the step down care right, because that really hinges around working with the care sector, making sure that people are in a safe environment where they can convalesce properly. So, you know, any amount of people isn't a good number, and it's not good for the service. So we recognise as a problem, we are actively taking steps to rectify this issue.
The Care Federation says they know of someone who's been in hospital for about 4 months. Are you hearing of cases like that?
I've not heard one of quite that length of time. You know, even a week or two is too long in my view. 4 months sounds like an incredibly long period of time to be in the hospital when you don't need to. So it's really important that we put all the programs and solutions in place to stop that happening.
And Becky